Every year, HFT and Care England conduct the Sector Pulse Check, a detailed report on the financial health of the care sector and the state of its workforce. This year's report highlights the pressing challenges and opportunities that care providers across the UK face. We want to share with you what we found and what that means for the people who matter most, those who rely on great care and support to live fulfilling lives, and the people who deliver it every day across the country. This year, as in previous years, we found that the social care workforce is in crisis, with a vacancy rate 3 times higher than the economy as a whole. Every year, roughly 1 in 4 care workers leaves the profession, saying they feel underpaid, under-resourced and undervalued.
I think the workforce has been stretched to its absolute limit. I think after COVID, we hoped that there would be an end, and I think actually what we're now seeing is a worse crisis because this crisis doesn't have an end in sight, and I think until the government listens and the people who can make change listen, I honestly believe that the workforce is going to be stretched beyond what it's capable of.
With so many pressures on the social care workforce, there is an increased risk of poor care. But we know how much people who draw on the care and support value their support workers and how strongly they believe their care workers deserve fair pay and proper recognition for the amazing work they do.
So they've got a can-do attitude, they're very engaging, encouraging, they're very willing, enthusiastic, they're happy, they're caring, and they're there for us really. I wouldn't have been able to do the self-advocacy work that I'm doing now without Elmi, Rachel and Steve, because I have my support staff, but they only have a certain amount of time with people, so I wouldn't have been able to do as much self-advocacy work as I'm doing now.
The financial landscape for the social care sector is bleak, and this impacts the services that can be provided. Many providers are having to consider cutting services, staff, investment, or simply shutting up shop completely, placing the care of hundreds of thousands of people in jeopardy.
We're seeing people coming into us more and more complex, and the way that we need to care for them is more and more complicated, meaning we need to have trained, really passionate individuals who love what they do and are able to deliver outstanding care. Without the right funding in place, that's not going to happen.
The reality is most care providers are struggling to keep their head above water right now, and the only reason that they are battling through such hard times is because they care so much about the people that they support.
So I'd like staff to get the higher pay, not the minimum, but the national living wage, because they're on the basic minimum wage, because prices are going up, like in the shops and homes and bills. They're struggling to afford stuff, and when they struggle to afford stuff, they leave.
It is a challenging time for social care, but there are solutions to these problems. In this year's report, we make 2 key recommendations to government to help fix the social care crisis and deliver the quality care that people truly deserve and that makes a world of difference. Firstly, the sector needs sustainable and long-term funding for the adult social care sector. This means that funding must cover the full cost of care so that providers can thrive. Secondly, our workforce deserves to have the same pay and conditions as the NHS. We are asking for a fully funded roadmap for care workers that recognises their skills, the care they give, and the difference they make. We asked some of the older people we support what good care means to them.
When first I came, I was very apprehensive, particularly in the mornings being changed, and I was very nervous. and thought I would feel embarrassed, but I did not feel embarrassed. Quite the reverse. I felt so comfortable and was so grateful to have the help, and she made me feel very, very pleased and happy to be here.
So Colin, what do you value most about your carers?
Empathy is having a greater degree of empathy.
Their stories are a reminder that with the right funding and reforms, great care is not just possible, it's happening right now. We need a thriving and sustainable social care sector that is fit for the 21st century. So what can you do to help? 2 simple things if you are able. Firstly, share this video on social media and to everyone you know, so they are aware of our social care crisis and the solutions we desperately need. And secondly, whether you're a policymaker, a politician, or a provider of care, whether you receive care or even if you're just a concerned member of the public, agree to our simple pledge: I will champion fair funding for the social care sector. HFT and Care England are ready to work with the government and the NHS to get our health and social care provision right. Working together as a sector and with our supporters, we have the tools to save social care. Now is the time to act.